Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about exercise during pregnancy. One of the things that I am asked sometimes is, what are some recommendations for exercise during pregnancy? And commonly you may be saying, okay, should I really be exercising during pregnancy? And the answer is yes. Now, with that, when you exercise, you want to at least start with the normal usual things that we do for anybody that's exercising. You want to make sure you get sufficient fluids. You don't want to get dehydrated, especially during pregnancy. You want to make sure that you do activities that are appropriate for your exercise level. So you don't want to overdo it or anything like that. You want to be wearing the appropriate equipment, whether that's the right types of shoes or the right clothes, etc., for the support that you need. You need to remember, with pregnancy, this is going to change a little bit because you have a little bit of increased weight in the front, for lack of a better way of saying it, which is going to increase your chances of falls and loss of balance. So what kind of exercises would be appropriate in this case? Truthfully, walking is a really good exercise. Yoga, as long as it's slightly modified, Pilates, as long as they're slightly modified, are good exercises for pregnancy. I think those are the biggest ones. Swimming and water workouts could be good. Stationary bikes as well. That's the other one I couldn't remember. So things that change during pregnancy are, you're going to have loosening of the joints. We've talked about this already. Because of the hormones that are released, the joints are looser, and so you have an increased risk of injury. So you want to be careful what you're doing. Your balance, like we said, and breathing. You have an increased need for oxygen when you're pregnant, so you want to be careful what kinds of exercise you do for that reason as well. Otherwise, there's really not any big things that I would say as a podiatrist when it comes to exercise. You absolutely can exercise. You just need to be careful about injury, wear the appropriate equipment, and get sufficient fluids, and be careful to not overheat. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 321.